Hi, everyone, and welcome to an episode of the Flex Audiology Show. Today, we are going to talk about the differences between transient tinnitus and tinnitus that is either intermittent or chronic. So stay tuned for that. Okay, so transient tinnitus is such an interesting phenomenon. And really, most people in the world have experienced it once or twice. So if you haven't, consider yourself very unique. But transient tinnitus is a sound that you hear in your ears for maybe a few seconds up to a few minutes. And typically, patients will report that they hear like a ping sound, and then their hearing kind of goes away. And you'll get maybe some ear pressure fullness. You just definitely can tell you're not hearing out of that ear. But pretty quickly, it does go away. I've had a couple patients that tell me it can last up to 5 to 10 minutes, but generally it goes away pretty quick. And the good news is that this is very, very normal. Like I said, a very high percentage of the population has experienced this phenomenon. Now, tinnitus that we would actually, or sounds that we would code as true tinnitus, would be something we'd code as either temporary or chronic. We can call it persistent. So let's talk about that and the differences for just a little bit. Intermittent tinnitus is tinnitus that you might have for a few hours at a time. And it can occur maybe, 2 or 3 times a day, or it could be 2 or 3 times a week, and just really kind of sporadically throughout your life. But when it does happen, it can be characterized as a humming, a buzzing, a hissing, an ocean sound, really any sound that is produced internally, not from an external source around you. So we will call that true tinnitus that you're hearing. And then defining it between temporary or chronic. Temporary is, again, like I said, it's kind of intermittent. It comes and it goes, but when it does come, it lasts for quite a while. And then chronic tinnitus is something that I see a lot of. That's usually when patients come into our clinic. Chronic tinnitus is going to be tinnitus that you've had. It'll continue to go either all day long, or maybe somebody like today said, I pretty much have it all the time, Dr. Person, but there's like 5 minutes a day that I might get some blissful silence. So that would be somebody with chronic tinnitus that's been happening generally longer than 6 months. So, but understanding tinnitus and how it's impacting you, or whether it's transient or versus it's something that's temporary, that really is the first step toward managing it. So the key is really to understand your tinnitus, and then from there, we can start to move into treatment options. So definitely, if you haven't yet, hit the subscribe button. Definitely follow us. Give us a thumbs up, because that helps spread information out into the greater area. And let's explore some treatment options in some upcoming videos.